Hello, everyone, and welcome back to our Health and Wellness podcast. I'm your host, Sarah. Today, we are diving into a topic that is incredibly important, yet often overlooked. It's a subject that might surprise many of you, especially those of you caring for aging parents, or if you are in your golden years yourself. We are talking about the hidden dangers of overtesting in medical care for seniors. To help us navigate this sensitive issue, I am honored to be joined by Dr. Miller, a senior specialist with years of experience in geriatric medicine. Welcome to the show, Doctor.
Thank you, Sarah. It's a pleasure to be here. This is a topic very close to my heart because, honestly, it's something not every hospital or clinic is willing to discuss openly. We often equate more testing with better health, but that isn't always the case.
That is exactly what caught my attention. Usually, the advice is early detection is key, right? But today, you're suggesting that for people over 70 or 75, certain tests might actually lead to more harm than good. That sounds counterintuitive. Can you explain the philosophy behind this warning?
Absolutely. Let me use an analogy to make it clear. Imagine the body of an elderly person is like a lion sleeping peacefully in the forest. It has scars, it has history, but it is resting. If you don't disturb it, it won't hurt you. But if you start poking it with sticks, meaning unnecessary tests, you might wake up a beast that you can't control. Or think of it like a vintage car.
A vintage car? That's an interesting comparison.
Yes, a vintage car that's been running for 75 years has wear and tear. The engine might make a little noise, the chassis might have some rust, but if it drives smoothly and gets you from point A to point B, you don't tear the engine apart just to fix a tiny scratch, right? If you do, you might never get that car back together again. The human body is similar. When we cross the age of 75, we are no longer brand new machines. We are valuable antiques.
I love that perspective. So you're saying that modern medical machinery often treats everyone like a new car, flagging every little scratch as a defect that needs fixing.
Precisely. Modern diagnostic machines are incredibly sensitive. They are designed to find problems. They don't know the difference between a life-threatening disease and a natural sign of aging. They just see a red flag. And once that flag is raised, it triggers a chain reaction of more tests, more anxiety, and invasive procedures that an older body simply cannot handle as well as a younger one.
That is a very sobering thought. It seems like we are conditioned to fear missing a diagnosis, so we test for everything.
That fear is what drives the industry. But we need to shift our mindset. The goal of medicine for the elderly shouldn't be to find every single flaw. The goal should be to maximize quality of life, maintain independence, and ensure peace of mind. If a test is going to steal your peace of mind or risk your mobility without adding years to your life, we need to ask, is it worth it?
That is a powerful question. Is it worth it? I think many families struggle with this because they want to do the best for their loved ones. They think buying the most expensive, comprehensive health check package is an act of love.
It comes from a place of love, certainly, but sometimes that love leads us into a trap. We call it overdiagnosis. It's when we find something that was never going to cause the patient any symptoms or shorten their life, but now that we found it, we feel compelled to treat it. And the treatment, the surgery, the drugs, the radiation, that is what ends up harming the patient.
Dr. Miller, I know you have seen this play out in real life many times. Is there a specific case or a story that really highlights this issue for our listeners? I think hearing a real-world example would help us understand the gravity of what you're saying.
Yes, Sarah, there's one story that haunts me. It's about a patient named Mr. Henry. He was 76 years old. When I first met him, he was arguably healthier than many men 10 years younger. He walked every morning, his skin was rosy, he had a great appetite, and he was enjoying his retirement. He was living the ideal life for his age.
He sounds like he was doing everything right. So what happened to Mr. Henry?
Well, that is what we'll discuss next. It all started with a decision to get a platinum health checkup, a decision that seemed responsible.
Before the break, you mentioned Mr. Henry, a healthy 76-year-old who walked into a clinic for a checkup. Dr. Miller, please walk us through what happened. How does a routine checkup turn into a tragedy?
It's a classic example of what I call the snowball effect. Mr. Henry didn't have any pain, he wasn't sick, but out of fear of cancer, he signed up for a comprehensive screening. The ultrasound found a small cyst on his pancreas. Now, in many people his age, these cysts are benign and can sit there harmlessly for the rest of their lives.
But the machine flagged it, right? And once you know it's there.
Exactly. Once you see it, you can't unsee it. The doctors were worried. To be 100% sure it wasn't cancer, they ordered a biopsy. Now, a biopsy on the pancreas isn't like drawing blood. It's invasive. Tragically, the procedure triggered a severe complication, acute pancreatitis.
Oh no, that is incredibly painful and dangerous.
It is. Mr. Henry went from walking in the park to fighting for his life in the ICU. He survived the infection, but the recovery kept him bedridden for months. His muscles atrophied, his joints stiffened. By the time he was discharged, he couldn't walk anymore. He left the hospital in a wheelchair.
That is heartbreaking. So he went in on his own 2 feet, healthy and happy, and left in a wheelchair, all because of a cyst that might never have bothered him?
Correct. And the irony? The biopsy results showed the cyst was benign. It was harmless. The cure was infinitely worse than the disease. We woke up the sleeping lion, and it attacked. This is the price of overdiagnosis.
That really puts things into perspective. We tend to trust technology blindly. We think if the machine says it's abnormal, it must be fixed. But you're saying the machine lacks context.
The machine only knows data. It compares an 80-year-old's test results to the standard of a 30-year-old. Of course it's going to show abnormal red flags everywhere. If you treat those red flags, you are fighting a war against aging itself, a war you cannot win.
So to avoid another tragedy like Mr. Henry's, we need to know what to look out for. You've prepared a list of 5 specific tests that people over 70 or 75 should be very cautious about. Let's get into the details. What is the first test on your list?
The first one is very common, the urine test, specifically looking for bacteria when there are no symptoms.
Wait, really? A urine test seems so simple and harmless. Why would you advise against it?
The test itself is harmless, Sarah. It's the result that leads to trouble. You see, as we age, our bladders change. It is very common for seniors to have bacteria living in their urine without causing any infection. We call it asymptomatic bacteria.
So having bacteria there is normal.
For many seniors, yes. It's like a peaceful coexistence. The bacteria are just hanging out. They aren't attacking the bladder wall. But if you take a urine sample and send it to the lab report will scream infection because the bacteria count is high.
And I assume the natural reaction is to prescribe antibiotics immediately.
Exactly. The doctor sees the bacteria, gets scared of sepsis, and prescribes a course of antibiotics. But since those bacteria weren't causing harm, the antibiotics essentially carpet bomb the body. They kill the good gut bacteria, cause diarrhea, and even worse, they breed antibiotic-resistant superbugs.
So we are creating a problem where there wasn't one. When should a senior get a urine test then?
Only when there are clear symptoms. If they have a fever, pain when urinating, blood in the urine, or sudden confusion. If they feel fine, do not hunt for bacteria. Let them be.
Clear enough. If it doesn't hurt, don't hunt for it. What is the second test on your warning list, doctor?
The second one is the ECG, or electrocardiogram, for routine screening in low-risk patients. Now, I want to be clear. If you have chest pain or shortness of breath, get an ECG immediately. But as a part of a routine annual checkup, it's often unnecessary.
Why is that? Isn't checking the heart always a good idea?
The aging heart is like an old clock. It might skip a beat now and then. It might have some electrical noise. These are often benign irregularities common in old age, but an ECG picks them up as abnormalities.
And I guess this leads to the snowball effect again.
You guessed it. A minor blip on an ECG leads to a referral to a cardiologist, then maybe a stress test, then an angiogram, and suddenly a healthy 75-year-old is on blood thinners or beta blockers they don't really need, dealing with side effects like dizziness and falls.
And for a senior, a fall can be catastrophic.
Exactly. We're trying to prevent a heart attack that might never happen, but in doing so, we cause a fall that breaks a hip. We have to weigh the risks.
We are back with Dr. Miller discussing the 5 tests seniors should think twice about. We've covered urine tests and ECGs. Dr. Miller, let's move to the skeletal system. I know many older adults suffer from back pain. This brings us to your third point, MRI scans of the spine.
Yes, this is a huge one. Back pain is almost universal as we age. The knee-jerk reaction is to order an MRI to see what's going on. But here's the secret. If you take 100 people over the age of 60 who have zero back pain and put them in an MRI machine, 90 of them will show abnormalities.
Wait, 90%? Even if they don't have pain?
Yes. The scan will show bulging discs, degenerated joints, maybe some spinal stenosis. We call these wrinkles of the spine. Just like you have wrinkles on your face as you age, you have wrinkles on your spine. It is a natural part of getting older.
I love that phrase, wrinkles of the spine. It makes it sound so much less scary. But when patients see the MRI report, they don't see wrinkles, do they?
No, they see words like degeneration, herniation, collapse. It sounds terrifying. It sounds like their back is about to snap. This fear drives them to demand surgery.
And back surgery is major surgery.
It is incredibly risky for seniors. The recovery is brutal, and the success rate for chronic age-related pain isn't as high as people think. Often, simple physical therapy, walking, and gentle movement are far more effective and safer than surgery. So unless there are red flag symptoms like numbness in the legs or loss of bladder control, an MRI often just provides scary pictures rather than a cure.
That is really important advice. Don't let the scary pictures push you into the operating room unnecessarily. Okay, let's talk about cancer screening. This is a sensitive area. Your fourth warning is about the PSA test for prostate cancer.
This is a controversial topic, but the data is becoming very clear for men over 75. Prostate cancer is unique. In many cases, specifically in older men, it grows incredibly slowly. We have a saying in medicine, many men die with prostate cancer, not of it.
Meaning they live their lives, pass away from old age or other natural causes, and the cancer never actually became a problem?
Exactly. If you screen a 78-year-old man and find early-stage prostate cancer, the treatment options are surgery or radiation. Both carry high risks of permanent side effects, incontinence, meaning wearing diapers, and impotence.
That sounds like a massive blow to the quality of life.
It is devastating. Imagine a man who has maybe 5 to 10 good years left. Do we want him to spend those years wearing diapers and feeling miserable because we treated a cancer that likely would have stayed asleep for another 15 years?
When you put it that way, the choice seems clearer. It's about calculating the time to benefit, isn't it?
Precisely. If a cancer takes 15 years to become dangerous, but the patient is already 80, the treatment will likely hurt him faster than the cancer ever would. It's a hard conversation to have, but a necessary one.
It takes a lot of courage for a doctor to say, let's not look for this. It goes against the fight everything culture.
It does. But real care is about protecting the patient, sometimes even protecting them from the medical system itself.
We are down to the final test on your list, Dr. Miller. This is one that everyone dreads, regardless of age, the colonoscopy. Why is this on the avoid list for people over 75?
Colonoscopy is the gold standard for screening, no doubt. But for patients over 75, the risks start to outweigh the benefits. First, the preparation. Drinking that gallon of laxative is extremely dehydrating and exhausting for an elderly person. It can mess up their electrolytes and cause kidney issues.
I've heard the prep is often worse than the procedure.
It often is, but the procedure itself carries risks too. As we age, the walls of the colon become thinner like tissue paper. The risk of perforation, accidentally poking a hole in the bowel during the scope, goes up significantly.
And a perforated bowel is a surgical emergency.
Yes, And for an 80-year-old, emergency abdominal surgery is life-threatening. Furthermore, colon cancer from a polyp develops very slowly. It takes about 10 to 15 years for a small polyp to turn into a dangerous cancer. So if you are 75 or 80 and you screen negative, you are likely safe for the rest of your natural life.
So again, it comes back to that time horizon. If the window of danger is 15 years away, we shouldn't risk a surgical emergency today.
Correct. Now, obviously, if you have symptoms, bleeding, unexplained weight loss, that is diagnostic, not screening. We absolutely investigate symptoms. But for routine screening, we need to know when to stop.
This has been such an eye-opening discussion. We've listed things not to do, but I'm sure our listeners are wondering, if we stop focusing on these tests, what should we invest in? Where should we put our time and money to stay healthy in our later years?
That is the best question to ask. We shouldn't just stop testing. We should redirect those resources. Instead of spending thousands on MRIs and high-tech scans, invest in prevention and nutrition.
Can you give us some specific examples?
First, vaccines. The shingles vaccine is a fantastic investment. Shingles is agonizing for the elderly. Preventing that pain is far more valuable than finding a benign cyst. Pneumonia and flu vaccines are also crucial.
That's practical advice. What about diet?
Protein. As we age, we lose muscle mass rapidly. This leads to frailty and falls. Many seniors eat too little protein, just tea and toast. Invest in high-quality protein, maybe nutritional shakes if needed. Keep the muscles strong so you don't fall. A broken hip is a much bigger threat to an 80-year-old than a hidden polyp.
Muscle mass as a savings account for health. I like that.
Exactly. And lastly, there is one screening I actually do recommend, but usually just once. An ultrasound for abdominal aortic aneurysm, especially for men who have smoked. This is a silent killer that can burst suddenly. It's a simple, non-invasive ultrasound. If it's normal, you're good. If it's large, we can fix it before it bursts. That is a high-value test.
Dr. Miller, we have covered so much ground today, from the sleeping lion metaphor to the specific tests to avoid, and finally, where to actually focus our energy. Before we let you go, I have one final thought. Many people listening might feel anxious about doing nothing. They might feel like if they aren't testing, they are being negligent. What would you say to them?
I understand that anxiety completely. We've been trained to believe that medical data equals safety. But I want you to remember this. You are not a statistic. You are a person living a life.
You are a person, not a statistic. That is beautiful.
If you wake up in the morning, the sun is shining, you have no pain, you can enjoy your breakfast, and you can talk to your loved ones, you are healthy. Don't let a piece of paper from a lab tell you otherwise. Don't let a machine convince you that you are sick when you feel well.
That peace of mind is priceless.
It is. The goal of your later years should be to enjoy the fruits of your labor, not to spend your days in waiting rooms worrying about numbers that might never matter. Trust your body. Listen to your symptoms, yes, but don't go looking for trouble where there is none.
And I think for the adult children listening, the caregivers, this relieves a lot of guilt. It's okay to say no to a test if it preserves mom or dad's comfort.
Absolutely. Protecting their comfort and dignity is the highest form of care you can give.
Dr. Miller, thank you so much for this incredibly honest and liberating conversation. You've given us permission to step off the medical treadmill and actually live.
Thank you, Sarah. It's been my privilege. I hope this helps your listeners find a balance between medical care and quality of life.
And to our listeners, thank you for tuning in. Remember, health is not just about the absence of disease on a chart. It's about the presence of joy in your life. If you found this episode helpful, please share it with your family. Until next time, stay healthy, stay active, and enjoy every moment. Goodbye.